Hello, everybody. This is Dr. James Flowers, and welcome to this edition of Understanding the Human Condition with Dr. James Flowers. Excited to have you all. Happy New Year. It's January 2023, and I have two really good friends with me today, both of whom I work with almost every single day here at J. Flowers Health Institute. First of all, we have Moe Schlachter of Houston Family Nutrition. Welcome, Mo.
Thank you, Doc.
It's
Good to be here as always.
Yeah, Happy New Year. It's
Happy
good
New
to
Year to
see you.
you. Yeah.
Yeah. And we have Dr. Clay Ardoin
Yes,
instead of
yeah.
Ardoin. Dr. Clay Ardoin. Tell everybody about yourself, Clay, and your practice, because I want everyone to know what an amazing physical therapist you are, a little bit about your background and how you work with our patients.
Yeah, absolutely. So I'm a physical therapist by trade. I own 7 locations here in Houston, and really what sets us apart from typical physical therapy is everything we do is all one-on-one. We give our full undivided attention to our patients, which is really necessary to see the type of results that we're trying to drive.
Yeah.
The healthcare system has kind of driven just kind of these patient mills where there's just 2 or 3 patients per
Yeah.
therapist. Each therapist is seeing 20 or 30 patients a day. My therapists see, like I say, one-on-one, and it really helps to kind of drive that quality of care. And that's kind of what we stand by is just giving that type of attention to our patients, and they really appreciate it.
Yeah. Having that concierge level of care. And people always ask me, well, what is concierge care and what does it mean? And I often talk about the silos in healthcare where people go to in typical medical communities, people go to a physical therapist over here and a nutritionist on this street and a therapist over here and an orthopedic surgeon over here or a pain doctor on this street, but none of them really talk to each other. The other thing that both of you do really well is collaborate with other people, right?
Mhm.
Collaborate with our team, collaborate on our patients, and collaborate with your referents, but also giving that one-on-one care so that if you need to spend an hour or an hour and a half or 2 hours with a patient, you'll dedicate that time with your patients.
Absolutely. And just like you said, I think building that team of just the network of referral sources around you where
Yeah.
that patient is just totally taken care of on every aspect
Yep.
and not being afraid to refer out and knowing exactly where your lane is and knowing the skills and the people around you that can also, facilitate the better quality of care for that patient. And at the end of the day, they're just getting everything they need on every single level.
Yep.
And we all communicate together very well. And it really makes a fun working environment also.
Doesn't it?
So
It
it does.
does.
Yeah.
It's really great working with complex individuals. And oftentimes, Mo, who's a nutritionist by education and training, but I think should be and could be a psychologist, because often Mo has some amazing insights, as do you, Clay, on our patients. And you'll come back, even though we spend a tremendous amount of time, our clinical team, with each and every single patient, really uncovering the complexities of every individual. You guys also help uncover complexities and come back because they're in a different setting with you than with a therapist or a psychologist. And they tell you things they often feel more comfortable telling you than they do us. So
Yeah.
tell us a little bit about your practice and how you work with our patients as well.
Sure. Yeah. So I'm president of Houston Family Nutrition and our sister clinic, Nutrition Behavior Therapy. And we have locations here in Houston and a location in Austin as
Mhm.
well, soon to be Dallas too. Like you said, I mean, the work that we do is kind of like therapy in some ways. I mean, there's a lot of, talking,
Sure.
goal setting, just assessing barriers. And I do find that, when the topic of conversation is food, there's a little bit of ease and comfort, coming in. So I find that people do, pretty well. And what I train my staff on is just gathering information, assessing, and passing it along to the
Hmm.
clinical team. They'll know what matters, they'll know, what's significant. And so we're just, part nutrition provider and part kind of information gatherer. And in that we can build really deep relationships with clients. And that's something, that I love that we do here kind of as a
Hmm.
whole team. You talk about being able to spend the time, but also just being able to connect human to human. And that's a big part of, how we're successful here.
Absolutely. Yeah.
Absolutely.
And you guys are great at motivating people. And since we're talking about motivation and we're talking about being January, talking about New Year's resolutions, it's January 2023. Clay, you're based out of one of your offices is based out of the Houstonian right here on the grounds of the Houstonian where we office. And the gym is dead at the end of December. I was in there every day at the end of December and no one was in there, right? Just a
Yep.
few people a day. and then January 1st hits and it's packed all of a sudden. So what do you see in the fitness world? I know you're a physical therapist, but you're obviously a fitness expert as well. And fitness is a huge part of your daily living, right? And
Absolutely.
what are you seeing in the fitness industry in January? And what are you seeing with New Year's resolutions? And are they really resolutions?
Yeah, I think I have a kind of a different take than most. I mean, a lot of people that go to the gym frequently, they really despise January
Yeah.
because of all of the new people coming and there's no machines open, people don't know what they're doing
Yeah.
and all that. And honestly, I like seeing that
Mhm.
because people are taking action
Yeah.
and part of their resolution and maybe it's getting fit and maybe it's just being more consistent,
Yeah.
that type of thing. So just getting there is half the battle. Just showing up is half the battle, right? Now,
Absolutely.
maintaining that consistency is another story, and having a plan
Mhm.
for that is really important. But it's hard. It's hard to change habits. It's hard to change behaviors. And that's one thing to, you know, make sure people understand is like not many people can see this through. So the fact that you're willing to get this started at least is a step in the right direction.
Yeah. What do you do when you're working individually with people getting back into the routine of working out in January? Give us some motivation techniques that you use to get people into the fitness, into the gym.
Yeah. So I always like to have people kind of break down their goals. Not that so everyone has like an end goal of what they want.
Yeah.
But a lot of times it's just setting realistic expectations and setting realistic goals
Yeah.
and making sure that, if you haven't been working out at all
Yep.
and your goal is to get to 5, let's shoot for 2. Let's
Right.
shoot for 2 days a week.
Yeah.
Let's not try to knock all this out. Like if you're not sleeping 8 hours a night and you're only sleeping 4, let's
Mhm.
try to sleep 6. Let's
Right.
try to sleep 5, right? Let's
Right.
go to bed just a little bit earlier, right?
Yeah.
And we'll slowly start to kind of get you back into regulation
Right.
and homeostasis. A lot of people, they write on all these goals and have all these big aspirations, and it sometimes just becomes overwhelming and
Yeah.
it turns into inaction.
Like I can't
So,
do that. I can't possibly go 5 days a week.
right,
And they quit.
right. And then they
Yep.
quit, and before they know it, it's
Yeah.
2024, and we're having the same conversation, or they're even further away from their goals from where they
Right.
were before, and they
Yeah.
have more responsibilities. It's
Yeah.
just like so, just trying to help people kind of map that out and show them that there's a different way to do it,
That's
and
right.
so that they can feel, satisfied at nighttime and they can get a good night's sleep and they feel like they're, stepping in the right
Yeah.
direction.
It's somewhat it kinda reminds me of training for a marathon, right? I've run 28 marathons, and I have not run one in about 5 years or so, but when I was running marathons for most of my adult life, talking to people and educating people about marathon training is similar, I think, to going back to the gym, and that is if you're training for 26.2 miles or you're training for 100 miles or you're training for 10 miles, whatever it is, don't get out there and start running 3 miles 5 days a week or 6 days a week. Get out there and walk 3 miles a day the first
That's a
week or
great,
2,
yeah,
right?
that's
Just get up and walk for 30 minutes, and then you do it for 45 minutes, and then you do it for an hour, then you may go jog a mile, right? Or a half a mile. But don't get out and start and say, "I'm going to the gym 5 days a week,
yeah,
every day," because at March, they're gonna wake up and stay home
yeah,
just
for
like they did
sure.
every other year.
I like to tell people to, just kind of remember why you got started.
Yeah.
The why is really important because motivation will fade at the end of the day.
What's your why? Yeah,
What is your why?
yeah,
Like, because weeks go by, months go by, and like that starts to become a little faded. It's a
yeah,
little gray. You can almost
yeah,
forget why you started.
yeah,
And, if you're relying on other people if your people are telling you to do this and you're doing it for them,
mhm,
you really have to do it for yourself. And
right.
those changes have to come within. And when that does get hard and it does get hard to stay with your goals,
It
like
does,
you just
yeah,
have to go back and be like, this is why I'm doing this. And that
mhm,
helps you to, get back on track because
yeah,
we're all going to fall off at some point.
sure.
And it's just trying to get back on the next day, the next meal. Right. We don't have a huge bender or a huge binge.
Yep.
You just get back on the next track. Mo can kind of speak to that. So,
Absolutely. I was going to just say, speaking of meals, Mo, another next to fitness is nutrition,
Mhm.
right? And everyone wants to go on a diet, right? In January. And I'm going to eat in December. And then January, I'm going to go on this new diet. So it's somewhat similar or just as similar to going to the gym in January. People start these new diets and they do dry January or they do salads in January. And then they fall off the wagon and they're back to their same eating habits.
yeah.
So tell us a little bit about your experience with the new year and what people tend to do and what maybe they should do instead.
Yeah, no, it is interesting being in these fields around this time of year because it is so notorious for the,
Yeah,
the New Year's resolution goals. And I think there's a basic split between the kind of goals that someone can set. They can set an action oriented goal or approach oriented goal, like I will go to the gym, I will do something that is action oriented,
sure.
and maybe a diet goal, which is avoidance oriented, or I will not eat X, Y, and Z, or I will not drink this.
Yeah,
And there's research on it. So there's a 2020 study that will say an action-oriented goal or a process-oriented goal has a higher statistical chance of sticking
yeah.
than an avoidance-oriented goal. And then there's also statistics on goals that are set with support baked in versus
Hmm.
goals that are set where someone just kind of, well, I'll do this on my own and kind of white knuckle it.
Right.
So, we find it very interesting in clinic. We'll see, a lot of folks come in and they'll talk about, I want to avoid X, Y, and Z. And we'll try to get them in touch with the why, just like Clay does. And we'll also try to get them thinking about the action oriented or the positive things that will be done instead of what we're avoiding. It could be, changing the conversation from, I want to have less sugar to I want to eat more fruits and vegetables, something
Right.
that's a little bit more action oriented.
Sure. Absolutely. And speaking of sugar, another huge thing that we're seeing in our society over the last few months, and it seems like every week I hear more and more about this on the news, on every time you open up my iPhone, there's something about Ozempic or Wegovy out there, and it's the new medication of the stars, right? And wealthy people who are wanting to go on diets and spend $1,000 a month on Ozempic or Wegovy, about $1,000 a month. But what's your thought on this new weight loss technique that people are using, the injection,
Yeah.
once a week injection, either Wegovy or Ozempic, and give us some of your advice on that.
Yeah. So, I mean, the injection, has a lot of good research behind it. As a diabetes medication, it's not necessarily a first line medication, but when, either first line medications fail or if a person's, system can't really tolerate the first line or the max dose of a first line, it's a medication that is brought on board and it
Hmm.
does have a weight loss side effect.
Hmm.
So, it's something that is effective. I think, when considering, interventions for weight loss or for diabetes, it's about risk management. It's
Hmm.
knowing that, the medication is going to present some kind of risk, but then it's offset by, the decreased risk of resolving, the primary condition.
Right.
So, I think it's everyone definitely got to talk to their own doctor and make their own decision about
Hmm.
it. But when we work with clients who either, might do surgery for weight
Hmm.
loss, medication for weight loss, a crash diet for weight loss.
Sure.
And we focus as a team on what the day after that intervention is going to look like. So, regardless of, what it was that got a person from point A weight to point B weight,
Mm.
we want to help them know that their lifestyle is going to sustain the progress that they've made.
Yeah.
So whether they haven't started their journey yet or they're, somewhere in the middle, we're going to help them build a lifestyle that, surpasses the effects of the medication, the injection, the pill, the surgery,
Right.
or whatever it might be.
Great. What advice? I'm going to ask you both the same question, and I'd love some feedback on that. So, what do you say to someone that's listening today that wants to lose 15 to 20 pounds, right? They're living their life, they're functional, they're working, they do a little bit of exercise, and they want to shed about 15 to 20 pounds. What's your thought on the best way in 2023 to lose 10 to 15 pounds?
That's a deep
It is.
question. I think going back to what Clay said earlier, I think it's getting in touch with the why first.
Yeah.
It's knowing, it's assessing how important it really is to the person and what they expect, for it to do for them, whether or
Mhm.
not it's well informed. Just
So
knowing.
maybe even writing it down. Why is this important for me?
Mhm.
Could be step
Yeah.
number one. Why do I
Absolutely.
want to lose 10,
Hmm.
15, 20 pounds?
Yeah. And then, at least for us, along with that assessment, is knowing what their history with losing weight is. Have they lost a pound before? Have they, are they very experienced? Have they, does their history give us clues as to what works for them?
Right.
And I think, maybe the best way to approach it is the way that we can assess in clinic to have either have worked for them or, has the best shot at working
Mhm.
for them. I know I'm kind of dancing around it, but, I can get more into strategies, but I'm curious by what you think.
Yeah, I think it's very important to find out how important that 10 to 15 pounds is, because I hear a lot of people say that and they
Mhm.
don't really want to do that.
Yeah.
So
That's
once
what I hear all the time is, "Oh, I wanna lose 10 pounds. I
right.
wanna
So
lose 20 pounds."
where does that fall on, the importance in your life at this time? Also setting like, okay, are you doing this to get ready for a certain date? Do you have
Mhm.
something coming up where you need to lose this by, or is this
Right.
something that we can push out a little bit longer?
Yeah.
Because I would take it in a different path depending on the time frame there. And then also, just kind of looking at the person's ability to sacrifice. Like, what are you willing to sacrifice to do this, right?
Yep.
These are the things that are restricting you, and we'll lay those out and say, okay, you eat out 3 times a day, right?
Mhm.
Are you willing to meal prep a little bit? You have 2 alcoholic beverages at nighttime. Are you willing to cut that down to 1 or maybe 2
Right.
nights a week, right?
Yeah.
So, if they won't sacrifice any of that, then it's like, well, it's probably not that important to them.
Right.
So,
Yeah.
you got to see like how willing they are to do that. And also their time frame, right? A lot of people are busy, people are parents and they're working
Right.
and all that stuff. So, a lot of people don't have an extra couple hours during the week to work out.
Right.
So, just trying to see what they do have available to them. So then
Mhm.
you can try to utilize that time for them and teach them that, okay, maybe you can't get away for an hour,
Mhm.
but 20 minutes is better than nothing.
Right.
Right. Can you get up 10 minutes earlier and do something?
Right.
So you don't need to block out 2 hours in the middle of your day.
Right.
Maybe it's 20 minutes, before your day starts and 20 minutes when you go to bed.
Right.
That can make a huge difference over the course of, weeks and
Yeah.
months.
It
So.
sure can. Yeah. Let's talk about chronic pain for just a minute. And really, for both of you, all three of us work in chronic pain with a lot of chronic pain patients. You work with inflammatory conditions, you work with sciatica and all types of spine pain.
Yep.
Tell us a little bit about your approach to low back pain and how to help someone from a physical therapy standpoint in overcoming something like either sciatica, pinched nerve, or any type of spine pain that someone may be having.
Yeah, I'd say that's a good question because I treat a lot of back pain.
Yeah.
80% of the population will have back pain at some point in their life,
Yeah.
and sometimes it does become chronic. And a lot of what we do is getting people focused on again their why and their goals, and trying to get them more focused on function rather than what is their pain score when they come in.
Right.
I want them to, okay, what are you trying to do? Are you trying to play with your grandkids? Are you trying to get out and swing the golf club? Are you
Right.
trying to get to the gym? Like,
Mm.
were we able to do that during the week rather than every time when they come in, someone's asking them what their pain is, right?
Right.
So
What's that pain scale?
what's your
Yeah.
pain? So their brain immediately just goes to pain.
Yeah.
So a lot of what we do is we try to kind of unravel that and
Mhm.
try to get them to kind of focus more on the functionality of what their
Mhm.
life could look like. Also, we treat their pain, of course, and
Yeah.
come up with a plan for them. And we set that out for them in a realistic timeline. And we make sure that they understand kind of what their process is, and having a team that also understands,
Yeah.
pain science and how to deal with that. Having those referral sources is huge because on a musculoskeletal standpoint and what we can do in the clinic and what you guys can do here in the office and
Mhm.
therapy sessions, it just like we've seen so many patients just go
Yeah.
from night and day, and it's
Sure.
really amazing to see what that kind of combination of therapy can do.
It really is. There's not very many places in the country really that have an interdisciplinary team to really work with chronic pain,
Yeah.
because if you don't approach it from a multifaceted and multidisciplinary way, then the patient will do well in physical therapy, but then they leave and their depression hits again,
Right.
or they're eating improper foods and the pain comes back up and they don't know how to manage it, right? So, from a nutritional standpoint, what's your best advice for chronic pain patients and anti-inflammatory foods and things like that?
Yeah, I think inflammation is the big one that we look after. So first is looking at the obvious contributors to inflammation, whether it's smoking, alcohol, it could be, poor sleep as well. So just getting those things, wrapped up, and then being very proactive, going back to, what I said earlier about proactive goals versus avoidance oriented
Mhm.
goals. Regardless of where a person's diet is at a given moment, there's always this opportunity to increase anti-inflammatory foods, right? There's increased fruit and vegetable intake,
Yeah.
right? Even if there's all this stuff that a person's distressed about, well, I do this late night eating, I eat the wrong things, or my cheat meals get away from me. You could always add more greens. You can always add more berries, nuts, and then you can get into some of the healthy fats with more fish and salmon. I think it's helping a person understand how important these nutrients are to keeping inflammation low.
Mhm.
And we can measure that. Something I love that we do here is we have, all the testing that we do, the diagnostics. We can show to a client, where their inflammation levels are at, and then, with a diet intervention, see how that makes an impact. So I think it's really just being more proactive, understanding that there are lots of different anti-inflammatory nutrient groups, and helping a person go from baseline to increasing them up to adequate levels.
Right. Yeah. Something I like to talk about with chronic pain patients is the way in which we perceive pain, right? And it's all through our nervous system, right? And when the nervous system is activated, the pain level increases. So the more anxious we are, we have higher levels of pain. When we eat fried foods, it activates the nervous system and it increases our pain. When we're not working out, right, it's going to increase our pain. And talk about the difference in working out between pain and soreness, because so many patients we send to physical therapy with chronic pain come back and say, "Oh my God, it hurt. I'm in so much pain." It's not necessarily pain,
Yeah.
it's soreness from working out and
Yeah.
adjusting.
And that can be hard to distinguish, when you had chronic pain
Yeah.
and you're starting to feel these changes and
Yeah.
things here and there. And we try to get them to understand that that is a normal
Yeah.
thing in the process of retraining the body and
Right.
getting yourself and your nervous system to adapt and to desensitize the area. You always almost have to sensitize it a little bit
Yeah.
so the body can change and can feel these things and adapt. So there's definitely a challenge when it comes to that, and just trying to keep the load and the type of exercise that you do at a level that they can tolerate, as to not overexcite the nervous system, and also to get them to buy in.
Yeah.
So that relationship between the therapist and the client is very important. They need to be able to trust that relationship, and that you're not going to hurt them, because they've been in pain their whole lives, for
That's
most of
right.
it. And if they feel like you're going to hurt them, it's kind of goes out the window.
Right.
So a lot of it's just having conversations and building that rapport with the patients, or even more important than the exercise itself. It's just like you have to be able to build that trust.
I completely agree. And I think the greatest way to build that trust again is working one on one, not in a big group setting, not working with 30 patients a day, but
100%.
working with a small group of patients individually, like you guys do and what you're experts at and what we do here. And so what we're talking about really is your total life and total wellness in a collaborative multidisciplinary setting. And the best way to attack a complex issue is not just with one individual, but really working with a team of experts in each area of healthcare, really. So, any closing
Yeah.
thoughts, Mo?
And, I think that really comes into play, especially around this time of year. We'll have folks come into clinic with a goal of, I want to eat healthier, or I want to lose some weight, or I want to, be,
Yeah.
more physically fit. And they have, they might have an idea that, I'm going to the nutrition guy to
Mhm.
accomplish these goals. And when we, orient a client to the idea that it takes activity and food and sleep and managing your stress and emotions and hydration and, getting your medical, stuff in order, that's where I think where the rubber meets the road. I think folks come in, they say, I want to do these things. I want to lose, this amount of weight, or I want to get this much healthier. But then when we have the conversation, well, working 60 hours a week and kind of bottling up all your stress really isn't working for you. Maybe, you might want to find someone to talk to
Yeah.
about that. Sometimes people are all for it. Sometimes, that's where they have to make a choice. Well, I didn't really sign up for that, or I'm not really sure that that's going to be part of the process.
Yeah.
And that's, I think, where, the motivation to like get these things done comes up against, what needs to happen. So I think my closing thought is just really orienting the listener here to the idea that anything in the realm of health or nutrition or physical activity goal, there's all these other elements that need to be considered. And a
Mhm.
360 approach really is going to be the best way to get it done.
Absolutely. And Mo, if someone wants to get a hold of you and talk about a nutritional consult, how do they do that?
Sure. HoustonFamilyNutrition.com. Easiest way. We have a lot of contact forms on there, and we'll get back to you real quick.
Excellent. And Dr. Clay, you're all over the city now. I know that. How do people get a hold of you guys?
Yeah, pretty similar to him. We have a really easy accessible website. It's SculptU. That's SCULPTU. PT.com, or you can give us a call 713-489-8182, and we'll
Excellent.
happy to chat with you about whatever you got going on.
Yeah, I can tell you guys that are listening today that these two individuals have helped countless number of our patients over the last several years and have had huge successes with our patients. And I enjoy working with both of you. And happy 2023. It's going to be a great year. You can reach them or me at jflowershelp.com or 713 783-6655 at J. Flowers Health Institute, or individually, you're welcome to reach out to either one of these two experts. But again, thank you guys and Happy New Year.
Thank
Yeah,
you.
happy,
Happy New
New
Year.
Year.
Yeah.
Thanks, Jen.